Hello, Mr. Smith. My name is Cynthia and I'll be your nurse for today. I'm closing the curtain for patient privacy, checking for safety, hand hygiene. Uh, Hi, can you please verify your name and date of birth for me? Okay, thank you. Um, do you have any allergies, Mr. Smith? No? Okay, great. So today we'll be doing a head to toe assessment. Okay, so I'm going to ask you 4 questions, two of which in which I will be whispering. Okay, so the first one is, okay, and then, okay, so my questions are, do you know where you are? Do you know who the President of the United States is? Do you know what year it is? And are you in any pain? No? Okay, great. The patient is A&O times 4, well groomed, does not have slurred speech. His patient is able to articulate. No hearing aids. No hard of hearing. Patient does not wear any, does not appear to wear any contacts, and does not have any pain. 0 out of 10. Okay, Mr. Smith. So now I'm going to inspect your head. Okay. I'm checking for bumps and hair distribution. Okay, everything looks good. The patient doesn't show any bumps, infestations with normal hair distribution. Okay, Mr. Smith, I'm going to check your ears now, okay? Okay, the ears are intact, with no redness or drainage or exudate. No tenderness or abnormalities. Okay, Mr. Smith, I'm gonna inspect your face. Can you sit for me? Okay, thank you. Okay. Your head is midline. No facial droop. Can you smile for me? Smile for me? Okay, thank you. I'm going to touch your cheek, okay? Did you feel that? Okay, great. So you don't have any droop. Your cranial nerve number 7, I believe, is intact. Color of the skin is appropriate for your ethnicity. Okay, so let me inspect your eyes. Okay. Okay. Now can you follow? Okay. So please just follow the light. Now an X. Okay, good job. Patient's eyes has no redness or discharge. No contacts, and you do not wear any glasses. White sclera. Pupil size 3 millimeters. Equal, round, reactive to light, and accommodation. The patient does not have any blurred vision. Cranial nerve 3, 4, and 6 are intact. Okay. Can I inspect your nose? Okay, let's see. Okay, so can you please hold your nose and blow out? Okay. The other nostril, please blow out. Okay. Great patency. Nose is intact from both nostrils. The patient does not have any difficulty smelling. Cranial nerve number 1 is intact. Now I'm going to inspect your mouth, Mr. Smith. Can you say ah for me? Ah, okay. Thank you. Do you wear any dentures, Mr. Smith? No. Have you noticed any foul odor or breath taste different? No? Okay. Can you smile? Puff out cheeks for me? And raise your eyebrows. Open your mouth and stick out your tongue for me. I think I did that to you already, Mr. Smith. Sorry. Okay. The patient's mouth has no cracks, no bleeding gums, no dental caries, no dentures, no foul odors. For your nose, mucous membrane, uvula, and for your mouth, the uvula rises and falls up with phonation. Tongue strength is 5 out of 5. And all your cranial nerves are intact. Great job. Okay, now I'm going to check your neck. Okay. Can you turn side to side for me? Okay. Patient's trachea is midline with no deviation, no swollen lymph nodes, no head or neck have no abnormalities. Okay. I'm checking your skin. Okay. Your skin appears not to have any breakdown. Intact with no macules or papules. Okay. Skin color is appropriate to age and race. No jaundice, bruises or pallor or scars. Okay. Now I'm gonna palpate skin, okay, for temperature. Okay. Okay, can you I'm going to tug your skin. Okay. Patient's skin is warm and dry. Skin turgor intact with no tenting. Can you please extend both arms out? Okay. Just extend them out for me, please. And then bring them back. And then push them, put them back out. And can you please move them in circular motion for me? Okay. Okay, when I press down on your shoulders, can you please push up for me? Like that? Okay, great job. Can you please hold out your hands for me? And I'm going to squeeze your fingertips. And then, can you please push up my hands? And flip them over and push down for me. checking the strength. Okay. Now, let me palpate your wrist, your pulse. Okay. Okay, your brachial. So bilateral upper extremities with full ROM, symmetrical. Can patient can raise and lower shoulders, no stiff or swollen joints. Nail beds are pink. Patient does not show any clubbing of the fingers. Brachial, radial, ulnar, and are all plus 2+ and equal bilateral. Muscle strength is 5 out of 5. Capillary refill is less than 3 seconds. And cranial nerve number 11 is intact. Okay. Good job. Excuse me. Can you lay down for me? Okay. And inspect your thorax. Okay. Can you please exhale and inhale for me? Rises symmetrical with no bruising or scars. Equals rise and fall on the chest. No use of accessory muscle. No signs of respiratory distress. Okay. I'm going to palpate your chest wall for tenderness, okay? Chest wall with no tenderness upon palpation. Now I'm going to auscultate your heart, okay? Aortic second costal interspace. Pulmonic left second intercostal space. Herb's point left third intercostal space. Tricuspid left fourth intercostal space, and then the mitral left fifth intercostal space. Apical left fifth midline, midclavicular line intercostal space. Now I'm going to auscultate, okay, for your lungs. One, 2, 3, 4, 5, 6. Vesicular lungs sounds amazing. S1 and S2 have no murmurs, bruits or thrills, regular rate and rhythm. Good job. Mr. Smith, do you smoke or use any tobacco? No? Okay. Do you use any oxygen? No. Do you have any respiratory conditions? No? Okay. The patient has no abnormal response. Okay, now I'm going to check your back, okay? Turn around. I'm going to inspect your spine. Okay. Checking for tenderness. Spine is erect with no bruising or scarring. No skin breakdowns or bony prominences or tenderness upon palpation. Okay. So now I'm going to check, okay? breathe in for me. 1. Just breathe normally. 1, 2, 3, 4, 5, 6, 7, 8. Please breathe in for me and exhale out. Thank you, Mr. Smith. Upon auscultation, vascular sounds are heard. All posterior lung fields. Okay, now I'm going to ask you, okay, let me check your abdomen. Inspecting. Upon inspection, there's no bulgy masses, distension of bruising, no scars, drains, or tubes. Okay. So let me check your 4 quadrants, okay? 1, 2, 3, and 4. Okay. I'm percussing here. Upon auscultation, no active bowel movements. Upon percussion and tympanic sounds throughout all 4 quadrants. No dual sound over right quadrant over the livers. Okay. Mr. Smith, do you have any nausea or vomiting? Difficulty eating? No? Okay. When was your last bowel movement? Yesterday? Okay. Was it normal? Color? Formation? Thing was fine? Okay. So you have no nausea, no vomiting, no difficulty eating, swallowing. Your last bowel movement was yesterday morning. Normal, no constipation, and no diarrhea or signs of blood. Upon palpation, I found no masses or tenderness in all 4 quadrants. Upon palpation, no distension of the bladder or tenderness and pain. Okay. Do you have any pain when you urinate? No. Have you noticed any blood in your urine? No. Okay. What about foul odor? No. Okay. No burning with urination. No foul odor. Upon expectation, no skin breakdowns. No Foley catheters in place. Clean. Okay. And no abnormal findings. I'm going to check your legs, okay? Let me see. Can you please, okay, extend your legs out for me? And then push them back inwards. And can you please move them in a circular motion for me? Okay. Upon expectation of lower extremities of legs are symmetrical with full ROM. Patient's 5 out of 5 muscle strength. Does not show any stiffness or pains in the joints or hip area. Skin color appears appropriate for skin is warm and dry. No bruising or skin breakdowns. Even hair distributions. Pals have no heat, remnants, or swelling. Feet appear very clean. No skin breakdowns or bony prominences, and nail beds are pink. Okay, let me palpate for edema. Okay, good job. Let me try this one. Okay, good job. Now, okay, palpating. Upon palpation, no pitting or edema. Dorsalis, pedis, and tibial, posterior tibial, popliteal pulses are all intact. 2+ and equal bilateral. Capillary refills within 3 seconds. Can you please stand and walk in a straight line for me? Okay. Now turn around and come back. Upon ambulation, patient shows to have a steady gait. Arm swings side to side. And no use of ambulatory devices. Romberg test is negative. Okay, now I'm going to ask you some sensitive questions, Mr. Smith. Do you ever have any plans of suicidal thoughts? Do you have a history of abuse? No. Do you feel safe at home? Okay. No suicidal ideations. Low fall risk and no history of abuse. Okay, Mr. Smith, we have completed your assessment. Thank you very much for coming. Hand hygiene. Everything is safe for you. Safety. Let me lower the bed for you. And let me lock the brakes. Side rails up for you. And here's your call light within reach. If you need anything, please push the button and I'll come talk to you. Thank you.